It's been great to see everyone here and meet so many people committed to the cause of patient safety. It really has been an exciting conference so far, and thanks to you, Kevin, and thanks to everyone for being here. As you've heard from Kevin, by day I'm a physician, internal medicine physician, and a healthcare researcher, healthcare quality researcher. By night, I'm a physician novelist. And in this next segment, it's going to be a little bit different because we're going to talk a little bit about stories and the importance of stories in our work. And as we move into that realm of stories, I'd like to start by showing you a few characters that you might recognize. Anyone recognize this character? Luke Skywalker. And this one's even easier. Right, Harry Potter. This is a tough one, actually. Imperator Furiosa for fans of Mad Max. And last of all, Dorothy. Dorothy. Right. So what do these story characters have in common? What sort of characters are they? They overcome the odds. What do we call odds overcomers? I like that. Heroes. I heard it. Wonderful. These are all examples of heroes. And what I'd like to talk a little bit about today is the kinds of heroes we need in healthcare. And let me begin with a little exercise, and just to wake everybody up after lunch. If you're, and this is partly to get to know you, if you're a physician, please stand up. Or surgeon. I'll count surgeons. Okay, if you're a nurse, stay standing real quick. If you're a nurse, nurses stand up, please. Physical therapists, occupational therapists, and other workers in allied health. Okay, if you're a quality worker, if you work in quality to improve quality in hospitals or clinics, please stand up. Thank you, thank you. And if you're a student, if you're a health profession student or allied health student of any kind, please stand up. Now, last of all, and most importantly, if you're a patient, please stand up. That should be everybody. That should be everybody who is able to stand. Now, look to the right and the left of you. These are the heroes that we really need in healthcare. These are the people we need to stand up for better care and healing. And we're going to talk a little bit today about how you can do that. Okay, you can sit down. Thank you. So, before diving a little bit into my story, not really my story, but my protagonist's story, the end of healing, I'd like to give you a little background on these journey stories, these heroes' journey stories, or as Dr. Tower said, classic epic hero stories. They've been around for a long time, and it's interesting if you ask Carl Jung, Joseph Campbell, or Walt Disney Productions, they'll tell you that not only are they the oldest stories, and not only would they say they're the best stories, but they'd say at some level they're the only kind of story. They're the only kind of really good story. And these hero journey stories have several characteristics in common that I think are important. First, they all involve a journey into darkness, into another world that we're not altogether sure about. You know that from Dorothy's story. And second, not only does the hero journey into the outer darkness, into what's wrong in the world, But the hero typically has an inner journey into his or her own inner darkness, those things that are difficult to face, that keep us up at night. And the hero confronts those. But there's one key characteristic of hero's journey stories that hasn't been talked about very much that I think's even more important, and that is that these stories are all stories of healing. Healing for both the hero, himself or herself, but also for the broken world he or she inhabits. And we know our world of healthcare is broken. We know it's in need of healing, and we ourselves as workers in that world are also in that need. So for those of you who work in that world, I think you know what I'm talking about. And I'd like to begin from here to go on to begin our own journey into that dark underworld. I don't know if you've seen this data, but it's rather shocking. Roughly half of physicians are burnout. If you ask them at any point in time today, do you think you can keep doing this for another year or two? One half say, I'm not sure I can continue. I'm not sure I can carry on. This is extraordinary. If you look across workplace environments, this is not usual. And I would venture to say it's not because doctors and nurses are wimps, or they're weak in some way. It has something to do with our practice environment, and we'll talk about that a little more. Things are worst of all in the primary care disciplines and in emergency medicine. And the degree of this burnt out issue is so high. I don't know if you saw the recent report on depression amongst residents and interns, but as many of you who have been residents or interns know, depression is the norm for residents and interns, and of course sleep deprivation has something to do with that. But what you may not have known is that up to a quarter of residents and interns at any point in time will admit to having serious suicidal ideation during their residency. And it ends up that doctors are about at double the risk of the general population of suicide. So this tells me this is a very serious problem and one we need to address. And I'm convinced that this problem is not rooted in weak physicians or health professionals, but it's rooted in the environment and the care delivery system that we work in. It's rooted in our work environment. So let's talk a little bit about our work environment. Of course, one of the main places we work is the hospital, right? And I believe that's part of the roots of the misery. American hospitals, where people put their greatest hope for healing, as most of you know here, are among the most dangerous places in the world for humans to go. They're far more dangerous than parachuting, than driving on our most dangerous highways. They may be part of our problem, and we'll talk about that. Every day in hospitals, more people are killed than, well, at least every week more people are killed in hospitals than were killed at 9/11. Now, the errors that continue to occur year after year in hospitals are not purposeful. Nobody wants them. Everybody working in their health in hospitals is trying to prevent them. They're accidental, and yet they recur year after year after year, and we haven't really bent the curve on them. And it should lead us to question, are hospitals really the best place for the majority of our healthcare spending and our healthcare? Many of you saw the recent report from Johns Hopkins in the British Medical Journal that confirms other data that shows that hospital mistakes are actually the third leading cause of death in the United States. And back with the Two Eras Human report of the Institute of Medicine, we thought it was only about 100,000 deaths per year. But now we know the true count of deaths using best methods, the IHI trigger tool to identify potential errors associated with mortality. We've learned that the true number is somewhere between 250 and 400,000 deaths a year due to medical errors in hospitals. This should give us pause in our most sacred halls of healing. And if this weren't bad enough, spending is growing out of control. You know, the U.S. healthcare budget is now at around 2.7 trillion, nearly 20% of the GNP, or 1 in 5 of our dollars is going toward healthcare. And yet, our system is so mistake-ridden and so error-prone. People are now spending roughly $20,000 either out of pocket or it's being paid on their behalf by their company through insurance premiums, etc. Roughly $20,000 a year, now up to $25,000 for a family of 4. Roughly $50,000 a year for an elderly family of 2. And the costs, as you know, are rising year after year. If that weren't bad enough, despite those rising costs, we've discovered, and several leading accounting firms have shown through independent analysis and the Government Accounting Office that roughly 1/3 of our healthcare dollars, $700 billion, are wasted on care that we know doesn't do any good, or on waste and administrative overhead and so forth that's unnecessary. That unnecessary care, by definition, does more harm than good. So healthcare workers find themselves in a daily ethical quandary, patients and providers, where doctors in their daily practice find it very difficult to do the good that they've been trained to do, where it's very hard in the way we practice to avoid the harms we know how to avoid, where it's very difficult to respect patient autonomy in the rush of care as we provide it today, and it's exceedingly difficult to give each person his due and allocate resources fairly. This comes home for me. I'm 1 day a week, I'm a primary care doctor in an hospital outpatient clinic. And this is a child's drawing that recently was printed in JAMA of a doctor's visit. And indeed, this is what it's like these days. Can anyone see the doctor? That's the one huddled over the computer typing, right? Doctors have become typists. Is this just? Is it fair? Is it good allocation of resources? What's made this happen? If he could travel to any of our clinics today, I think Osler would say that it's unjust, the way we're spending our healthcare resources, and the way the healthcare that happens in the hospital and the clinic isn't driven often by what's best for the patient, but is driven by what's good for the insurance company and for the hospital and for payment, not for care. So this situation hit me really hard around 2000. And I'd been working for almost, over 10 years at that time as a healthcare researcher. And combined with 9/11, which happened to be my birthday, I realized that I could write an article in the New England Journal of Medicine every year, or even 2 or 3, and it wasn't going to change the minds and hearts of the American public. That what we really needed were some good stories, and I know every one of you have them. And I started to think at that time about what that story might look like, and I thought, what is the greatest epic hero story of a journey into the dark underworld that's ever been told? What do you think? What's the greatest journey story of a journey into hell? The Inferno. And of course there's a movie out by that title right now. But I thought back in 2000, I wonder if Dantes Inferno might be a good framework for a story about healthcare and where the ethical problems lie. So I decided to try and write a story to point the way out of the dark underworld of modern healthcare. And looking at this story, of course, many of you may know how it begins. In Italian, it's all poetry. It's not a pure novel. Nel mezzo del cammin di nostra vita, mi retrovai per una selva oscura, che la dritta via era smarrita. In the middle of the way of our life, I found myself in a dark wood where the straight way was lost. This is where my novel begins for my young protagonist, Don Newman. His awakening, like Dante's before him, happens in the middle of a dark night when he's on call in the hospital, when he's called to the bedside of a woman named Sybil Bellamy, who's had a massive stroke, from which he knows she has no meaningful chance of recovery. And she knows, because she's been back and forth from the hospital to the nursing home several times with recurrent aspiration pneumonia. And she's ready to go. And yet he's been called to put an IV in her neck that he is sure that she wouldn't want if she could tell him. And I'll read this little bit of this scene when he meets her at the bedside and prepares to put in a central line. A voice in his head whispered the oath he had taken at the beginning and again at the end of medical school. And at least I will do no harm. Bullshit. Harm is my business. How could any good ever come out of what I'm doing here to Sybil Bellamy? Then he's faced with a choice, like Dante Alighieri before him, and like Neo actually is asked of Morpheus in The Matrix, in that great film. A question like I'm asking you here today. Whether you'll stand up against the status quo for something different, for something better. When Don meets his mentor, Dr. Gil Sampson, to learn about the Ivy League graduate program that Dr. Sampson runs in health system science, Sampson tells him, let me see if I can find this quote. He says, our fellows train to become agents for health system change. They study how health systems function and analyze the root problems of American medicine. I'm looking for the doctor who wants to take on the status quo, the doctor for whom making money is not the first concern, the doctor who wants the healthcare business focused on the patient instead of the paperwork, the doctor burning with desire to bring true healing to the American people. Sarah tells me you're that kind of doctor. Is it true? And then he goes on to describe the difficulty he has recruiting young doctors into his program in health system science. He tells how it's not easy for doctors to choose that sort of path to go back to graduate school to learn how to change the system when they're on average $200,000 in debt, and there's so many more lucrative job options open and readily available, doing business as usual in the system as it is, rather than working to make healthcare better. Sampson admits as much, telling Don how lucky he'd be to join his program. He says, plus, our fellows earn a degree in public health, the one degree guaranteed to lower your starting salary. You know it's true, those of you who've gotten that degree. And then Sampson goes on to ask Don the question I'm asking you. Listen, you have a choice. You can go back to the wards, try to forget this little conversation, and work for the medical system as it is. Or you can follow me to the bottom of the rabbit hole. If you come to Florence College, all I can promise you is the truth. No salary guarantees, no fancy car. My program isn't easy, and only time will tell where it will lead. But you will learn the truth about the healthcare industry, and you might find yourself in position to change things for the better. So the choice is yours. What are you going to do? Do we have the courage to face the truth, the dark side? The resilience and grit to take the hero's path with Don and stand up and demand better care? If you do, let me give you some clues on how I would suggest you proceed. And actually, I would recommend you follow Dr. Sampson's advice in his first seminar with his students. He says, if you want to understand the truth about American healthcare, follow the money. Follow the money. And you know it's true. If you travel with Don on his hero's path and you follow the money, you'll discover what many of the most profitable healthcare companies in America don't want you to know. As Dr. White, another one of Don's mentor, tells him, she says, payment has nothing to do with quality of care or results. So it's not whether you kill or cure, it's how you code the claim. Isn't that true? It's about the paperwork. That's what's important in our system today, right? In fact, hospitals make more money when they make mistakes, still, despite some of the new incentives in Medicare through the Affordable Care Act. Doctors make more money when they rush and do a shoddy job, and insurers make more when they deny needed care. Is that just? So, Don, my young protagonist, who was raised by an Italian mother, happens to be a little familiar with Dantes Inferno. And when he gets confused, he turns to it a bit. And he uses Dante's Divine Comedy as a secret key that unlocks the secrets for him of the healthcare business. He journeys through the underworld of the healthcare industry on sort of an investigative reporting adventure. And in the Inferno, it ends up, Dante catalogs every type of ethical misstep that humans can make, moving from bad to worst. And up in the upper levels of Dante's Inferno, you find mistakes related to, or errors related to indulgence, overindulgence, or incontinence. And farther down, you find mistakes of violence. Mistakes of violence, which we certainly have in healthcare, don't we? And at the lowest levels, you find what he sees as the worst kinds of sins, the worst kinds of mistakes, intellectual sins, mistakes of deception and fraud. And of course, we do know a little bit about fraud in healthcare, don't we? And of course, the worst kind of fraud of all is treachery. Treachery to our right lords and masters, which in the case of healthcare ought to be our patients, right? So my protagonist, Don Newman, discovers that for every ethical misstep that Dante catalogs in the Inferno, there's a corollary in healthcare. And he discovers that Dante's framework provides the perfect ethical framework for us to understand the problems in American healthcare. Now, how many of you have seen this diagram before? It's part of the advertising for the Inferno. This is a drawing by Botticelli, the great Renaissance artist, but now suddenly is popular. But I want you to remember that my protagonist, Don Newman, discovered this Botticelli drawing first, before Dan Brown. This is Botticelli's depiction. And while Don is in this graduate health system science program, he doodles in the back of his journal a parallel diagram like Botticelli's to use what he learns from his biostatistics, epidemiology, and health economics classes in his Ivy League graduate program to detail the money spent, the lives saved, and the lives lost in our healthcare industry as it stands today. And what he discovers, if you look up at the billions spent there, and this is in year $2000, where we spend the least money on outpatient care, less than a third of our healthcare dollars on primary prevention, primary care, we save by far the most lives. And we have the fewest deaths due to medical errors. As we enter the realm of the hospital, into the world of hospital care, that's where we spend most of our money, right? Is in the world of the hospital. And much of it we spend after things are too late, after they could have been prevented, like the 2/3 of cancer deaths in America. And once we get in the hospital realm, not only do things cost a tremendous amount, but very few lives are saved, it ends up, if you look at the data carefully. And lots of lives are lost. In fact, it's even reasonable to ask the question, do hospitals save more lives than they cost? I think that's a reasonable question today. But I'll encourage you to study this diagram further in the back of my book, The End of Healing. So like Don, I think we have to ask whether the time for our outmoded hospital-based rescue care focus system has ended, and whether we need a new kind of system to deliver better care. And this really comes home to Don when he realizes the level of waste in healthcare and realizes for the money spent on fraud and high profits in healthcare, Americans could hire 10 million teachers. What would do more good? Maintaining exorbitant profits for powerful healthcare companies, or teaching our 70 million children how to improve their own health? I think all of you could answer that question, and I think you know we can do better. So now really is the time to take action, and I hope my story will give you a little bit of a guide, if you read it, to where and how we might take action. What Don discovers is we have to stand up, and it's not standing up to continue in the grind of everyday care as business as usual care. We really have to stand up to expose our own mistakes, recognize our own mistakes, and work with determination for real system change. To work for reform of the titan industries in healthcare, these dysfunctional industries, insurance, pharmacy, diagnostic testing, and the hospital industry that dominate everyday care today, and can also be part of the solution. So to stand up, I think you do have to know the truth. And I think to know the truth about American healthcare, I think it will help to walk with Don and hear and understand what we must require of our healers and discover what true healing looks like in today's world. And we have to recognize that the solution is really about not so much about managing care, but managing money. And at one level, all we'd have to do to fix this problem is to take the misspent billions on rescue care and fraudulent care and move them to primary and preventive care where they can do the most good. The problem is every bit of that money is some industry's gain, and they won't give it up easily. So we do need to bring that misspending into the light. So what can we do? First, we can stand up and make healthcare accountable. And that starts with every hospital bill, every bill from the insurance company being easily understandable, documenting the services provided, who is paid for what, and the administrative costs as parts of that. Second, we have to invest in new models of care. And that means investing more in primary and preventive care to keep people out of the hospital in the first place. And some of that movement is really already ongoing. And finally, we really have to work to flip the system, to turn healthcare on its ear, where we make the emphasis outpatient care rather than the more expensive hospital and hyped care, diagnostic care. And so what would that look like? And I think as we always think we're going to have to give up something if we reallocate our healthcare dollars. But I think what you've seen today is that we can give up a lot of harm and instead choose to have primary care clinics in every neighborhood that don't have inadequate infrastructure, but instead have diabetes educators, have mental health workers, since almost every person has some difficulties with their day-to-day life in terms of anxiety, stress, etc., where every clinic has nutritionists, pharmacists, and can bring a real team-based care approach to get, and every clinic has health coaches to get people and help people see the path to take charge of their own health, since we know we can be our own best doctors in our everyday life if we have the right guidance. I think that's what it means to flip the system. And finally, let me conclude by just reading this quote from Paul Grundy. What patients want is that deep relationship with a healer. This is the foundation upon which we need to build healthcare. And I think this is achievable, but it will take us standing up and demanding it. Thank you very much for your time.